Okay, this video is what are the lab tests for kidney function. So these are just the most common, most important ones. The first one is the BUN. That stands for blood urea nitrogen. Blood urea nitrogen is an indicator of how well your kidneys are able to remove nitrogen from the blood. Nitrogen, when it's floating around in the blood, is toxic. Only protein has nitrogen in it. There's no protein in carbohydrates or in fats. There's no nitrogen in carbohydrates or fat. So the liver takes the nitrogen that's extra that the body doesn't need, and it makes that into urea, and then the kidney excretes it. So the BUN is the ability of the kidney to clear nitrogen, urea, from the blood. If you eat more protein, your BUN can go up. If your kidney is less able to excrete it, your BUN will go up. It'll be increased with dehydration. You can actually make your labs look better by drinking water first. It'll hydrate you and dilute your blood. High protein diet can increase BUN. Being in kidney failure, of course, because you can't excrete it. Hydronephrosis just means obstruction of kidney outflow in the ureters, for example, or the bladder. That can also contribute to it. Excessive GI bleed will also make it go up. Abnormally low BUN, when you have liver disease, you can't make urea. I talked about overhydration. So anyways, the bottom line is when you got kidney failure, your BUN goes up. And also when you're eating a high protein diet. So what you're actually trying to do when you're trying to save your kidneys, you've already got kidney failure to a moderate degree, let's say. You want to reduce your dietary protein intake. Therefore, the same amount of protein filtration, nitrogen removal by the kidneys will lead to an improved BUN because there's less protein being eaten, less coming into the body. Okay, the next one is GFR, glomerular filtration rate. And the glomerulus is the part of the kidney that's, the beginning of the nephron, the filtration system of the kidney to filter the blood. They say normal is greater than 60. They define, you have kidney disease, significant kidney disease when your GFR goes below 60. But, a healthy young adult can have a GFR like as high as, 115. A good way to think of it is average GFR of a young healthy adult being about 100. And that's with 100% kidney function of about 1 million nephrons. Nephrons are the little filters in the kidneys. With aging, some decline in renal function is to be expected. When people start getting below GFR of 60, glomerular filtration rate of 60, that's said to be they have kidney disease. When they have a GFR of 60, then they've only got 60% of their original kidney function. So they got about 600,000 nephrons. If somebody donates a kidney for a kidney transplant, they then will have only about 50% of their original number of nephrons. So they'll only have about 500,000 nephrons. GFR about 30 is about 30% of original kidney function. That's when you start really getting into trouble and really being at risk for all sorts of things start going bad. You have more difficulty with acid-base balance, and now you're at big time increased risk to drop down to a GFR of 10. Once you get a GFR about 10, that's typically when a patient goes on dialysis. So anyways, GFR is the bread and butter for measuring kidney function. We check it every day on every single patient that comes for an injection iodinated contrast, on every comprehensive metabolic panel, CMP. It's just a routine thing to always look at GFR. Okay, creatinine is an indicator of a waste product from the muscle tissue breakdown. There's normally muscle tissue breakdown and rebuilding of muscles, and when a muscle is broken down, a muscle cell, creatinine is released into the blood, and then the kidney filters it at a relatively steady rate. This can go up if you lift weights a lot and you have big muscles. There'll be more creatinine in the blood. Lower creatinine is characteristic in patients who have a lack of muscle mass, like spinal cord patient. Creatine dietary supplements can also lead to a bit of an elevation in blood creatinine. If you eat a lot of meat, a real lot of meat, soon before you measure the labs, that can cause it to go up. And sort of the whole goal of most treatment of chronic kidney disease is to try to maintain GFR and prevent any further loss of glomerular filtration rate, to prevent proteinuria, like albumin is the blood protein that typically leaks into the urine, albuminuria, albumin in the urine. So anyways, those are the basic tests of kidney function. So you're going to hear about BUN and GFR all the time. GFR is by far the most important one for clinical practice. Every single day, that's like one of the first things we ask about a patient. So hope that was helpful.